Now heading over to Eastern Cape, the Premier there, Oscar Mabuyane, is ramping up the province's community-based COVID-19 response. 18 state-owned facilities are being turned into quarantine sites as infections increase rapidly. Now hospitals are filling up, threatening to collapse the healthcare system. And the province has over 38,000 positive infections. Our reporter, that's eNCA senior reporter, Aviwe Mdila, joins me now from Bisho for more. Aviwe, good morning to you. We've heard, of course, from the Premier addressing the country this very morning on just the state of preparedness, but also the pressure with which the province is currently feeling there. I mean, we understand that as those numbers increase, the healthcare system seems to be under pressure at the same time.
Certainly, Dumela, the Premier just wrapping up that briefing moments ago where we heard that the 4 hotspot areas are in fact Port Elizabeth, East London, Mthatha, as well as Queenstown. We do understand that 18 state-owned facilities will be turned into field hospitals to cater for about 2,000 beds. But just before we get ahead of ourselves, I want to catch up with the Superintendent General of the Department of Health in the Eastern Cape, Dr. Mbengashe. Dr. Mbengashe, thank you for joining us at eNCA. But I just want to recap, just before we talk about these field hospitals, of course, about Cecilia Mabuyane Hospital, where the Minister visited about 3 months ago, promises of field hospitals there. What's the latest on that avenue?
There's been a great development in the Metro, Nelson Mandela Metro. We are now actually on the 1st of July. We opened 1,400 field hospitals in the new Volkswagen South Africa and Department of Health collaboration, where we're building up 3,600 beds over 4 phases. The first 1,400 beds have been opened. We have over 30 patients who have actually come in there. I think what's been really important is that when we plan our plan in terms of responding to the COVID, we estimated that there are 2 really big areas that we needed to make sure we're doing. One was to make sure that we've got sufficient isolation beds, and these were done as part of a field hospital. We plan to have 8,000 of those. 4,000 was going to be in Nelson Mandela alone. Every district will have its own 500, and that adds up all to the different hospitals.
Dr. Mbengashe, I just want to go to Cecilia Mabuyane again. What's happened there? What happened in terms of the field hospital there, as well as field hospitals that were promised in Butterworth, 500 beds, as well as Mthatha General, another 500. What's the latest in that score?
Yeah. You see, remember, what will happen is that when you deal with Port Elizabeth, you're talking about Nelson Mandela as a compound of a system. So what's really important in terms of Doranginza, the people of Doranginza, they're also catered in the field hospital that I talked about. But I know that you want to talk about very specific issues of the incident that happened in Doranginza.
In Buffalo City Municipality, Cecilia Mabuyane just here in Mdantsane, and also just in the Ortamba region in Mthatha, as well as just in Butterworth, the field hospitals that were promised there. That's not Nelson Mandela.
Yeah, so in East London, in Buffalo City, we've got the old Cecilia Mabuyane Hospital, where we've got over 600 beds into that. We are renovating those beds now and actually make them available. The second thing that we've done actually in the Buffalo City area is that we have actually repurposed a number of hospitals, both at Frey Hospital and in the Cecilia Mabuyane. And we're really going to be building up additional beds in terms of 100 beds plus the ICU beds. That has been awarded already, and that additional 100 beds is going to be part of the Frey establishment. So we have made provision in the East London Buffalo City, but we're also going further onto that because we understand there's going to be a higher level of expansion, especially around King Williamstown. So we're looking at the Ulembu to actually create more.
I just want to touch lastly. We've heard complaints from doctors in Queenstown that there are no bed capacities there. What's the situation in the Eastern Cape as a whole? Do you have enough beds? And what happens to patients that go to places like Queenstown that don't have beds?
Actually, we've got enough beds in the Eastern Cape. In the King Williamstown area, we've got the Bishop Hospital. We are now going to be we're cleaning it up. We're going to have another 260 beds. We've got also around 100 beds at the old hospital at around the East London, around King Williamstown. Now, I think what's really kind of we're finding is that the key issue for us is that there are sufficient beds What we need to do is to actually manage the totality of our beds, because we've got sufficient beds. In terms of the total number that are in hospitals today, it's about 958 people in the hospital as of yesterday. So the capacity of beds is there. We've been actually expanding and getting more beds. So the expansion of facilities and beds is going to be there. But what's also very important, which we should need to share to the people of the Eastern Cape, is that we're actually creating what is called reticulation of all our COVID positive beds, because we had developed these 3,000 beds, but when we add and overlay oxygen onto those, we are now having a higher level of capacities of managing severe and critically ill patients. Our sense where we're sitting, we think that in terms of our progression and our planning, we have created and we are creating more beds as the problem gets worse. We got what is called a stress test in Dora, and we actually understood how do you really manage the portfolio of services that you have, and how you make sure that those beds are optimized and used at the right time at all the time. So we are really ready for the COVID-19.
Thank you very much. Ready for the COVID there. The Superintendent General in the Department of Health in the Eastern Cape, Dr. Mbengasha, basically saying that the province does in fact have enough beds. That is, of course, as the numbers surge, 38,000, an expected surge, in fact, that we had from the Health Minister. Expected Eastern Cape, one of the 4 provinces that are expecting higher number of infections over the month of July.
Indeed. Well, thank you so much. Our senior reporter, Avium Taylor, they're talking, of course, to the superintendent, but also hospitals, they're being refurbished within the province. ICU beds as well are expected to have and, have more additional beds, approximately 100 beds more, which will, of course, be added to them. But there's still